Hey, and welcome back to another video from HSTV. And in today's video of Medics Wednesday, I'm going to be showing you guys all of my medicine notes from my first year studying medicine at Edinburgh University. Now I guess this will be a little bit of tech involved as well, because I'll be showing you them on the Tab S7 Plus. That was my main tool I used to save my notes, read my notes, take my notes, all that stuff. And I'll be showing you them on Samsung Notes, because that is the application that I use to take my notes. Now if you do want information on how I actually take my handwritten notes, I've made a whole note-taking series, so please do go check that out. But really, this video is all about reviewing my first year topics that we got taught, and I hope that it is helpful for those of you who are starting medicine at Edinburgh in September of 2021, because the curriculum changed and it will be changing next year for the year 2s as well, which will be us. So really, they're rolling out a new curriculum, and I hope that I can show you every year what you guys have to look forward to, whether you're joining Edinburgh or if you just want to compare your course from wherever you're studying medicine. So I'm going to be going through my favourite topics I found hard, and just kind of reviewing really all of the modules that we did. So if you are excited, let's get onto it. Okay, so if we go into my Samsung Notes, as you can see, I have got 3 folders. The first folder being called the main MBChB Year 1 folder, all my uni staff study group, which I'll also show you a bit about. Not really got a to-do list going on at the moment, and I've got another folder as well. But anyway, so let's go into the main MBChB Year 1 folder. Now, as you can see, I found it quite convenient to split up my notes into Semester 1 and Semester 2. So let's start with Semester 1. And as you can see, there was quite a few modules to get through, the main physiology module being body in motion. So let's hop into that. And you can see that we did 5 main modules. So starting with the nervous system, then these are the sorts of topics we included. Now I thought this would be quite helpful, especially for high school students, because a lot of people think and kind of say to me as well that do we ever use the stuff we were taught in high school, biology or chemistry, in medical school? And the answer is yes and no. So stuff like synapses, that is gone into more depth at medical school, and you do need to have a basic knowledge, especially with like the sodium potassium pump. If you kind of do advanced higher or A-level type qualifications, then you will do the sodium potassium pump, and actually there's a lot more of that in the nervous system side of the module at medical school. So you do need to know that in quite a bit of depth, and you'll be taught that. They'll go over it, because again, everyone comes from different stages. You know, we'll have some students who are even graduate students who haven't looked at this stuff for a long time, and so actually we do go through all of it, but this is just to sort of give you an idea of the sort of stuff that we go over in the nervous system module. We go over neuromuscular disorders, we go over a little bit of multiple sclerosis, as well as ALS. We go over them briefly as well, not in a lot of detail. We don't really get tested much on them, but you know, good to know them as a neurological disease. We go through quite a bit of neurotransmission, again looking at excitable cells, synapses, and so on, and neurotransmitters. So I guess that for this topic, there is quite a bit that is carried on from high school to medical school, and it is nice to have that basic knowledge. They do go over it, but really, if you know it, it makes the stuff a lot easier. Okay, so the other quite large topic from Semester 1 was about locomotor, and there was quite a lot of new stuff in here actually. So we looked at mainly, kind of the main thing we were looking at is bones, osteoarthritis, movement, the cartilage, extracellular matrix, rheumatoid arthritis, sort of all to do with bones and movement really. So if I go into the bones folder here, you can see that these are the sort of topics that we went over. We did quite a bit of work on bone cells, so things like osteocytes, osteoblasts, osteoclasts, and so on, and kind of their functions, their locations, their origins, and so on, kind of what their role really is in bone. And other than the bone cells, we went over the physes, which is that kind of growth plate idea, and that was quite an interesting lecture. I found it interesting, at least. So other than the 5Cs, we also did calcium homeostasis, which is quite a confusing part of the course, I found actually, but once you kind of get the hang of it, there's a really nice diagram right here actually that hopefully they'll include in next year's lectures as well, but really that's a nice diagram to summarize everything up. But really, don't worry about it just now. Go enjoy your summer holidays. But just giving you a bit of a heads up that is something that you will also go over. We also did structures of bones, etc. Also, in the locomotor topic, we did quite a bit of stuff on different types of cartilage and connective tissues as well. So we looked at articular cartilage, for example. And as you can see, there's some notes that I've done handwritten and other notes that I've just imported PDF and lecture slides for, just depending on, time restraints and the complexity of the notes as well. So you can see, get a bit of an idea there. Okay, so what else in locomotor then? So sporting injuries was there's not a lot of clinical stuff in first year, but that is something that they've started to bring in more of now. So you can see that we've put it into more context by looking at sporting injuries, rheumatoid arthritis, osteoporosis, and osteoarthritis. So you can see we did a few on osteoarthritis there, and we've got a few, one actually on osteoporosis. There's quite a key difference there, so please don't get them mixed up. Rheumatoid arthritis we actually did a lot of in semester 1, and we did that in another module as well that I'll go over in a minute. Sporting injuries, that's just kind of stuff like you can see here, like kind of broken bones, different types, shoulder dislocations, for example, really common kind of stuff that you would see with sporting injuries. And again, bringing in that knowledge of the muscles and the anatomy side of things that you're learning about and putting it into a context with locomotor and then a clinical context with sporting injuries. So it's quite nice to see those links coming along. And we did a bit of trauma as well, actually. So this is really about different types of fractures, fracture healing, limb-threatening injuries, and kind of basically life-threatening injuries as well. And there's another topic that we actually did in a different module, and I'll go over that as well, but related to trauma, kind of linking things up, but we'll go over that in just a second. Okay, the next module then to look at was about homeostasis, so really controlling, things when they go up or down in the body. So I did all of this handwritten, and I actually really liked these notes because I made some really nice kind of flow charts, and it just kind of made sense in my head. And I'd really recommend that if you are going to take handwritten notes at any point, really do make flow charts. It really helps to understand things and make sense of things. Now look, this is the kind of stuff I'm talking about from high school, so you know about hydrophilic and hydrophobic and this phospholipid bilayer. You know about these structures from biology at high school, so stuff like this that we kind of build upon at medical school as well. Some kind of nice analogies there. I really liked the lecturer for this topic actually. He was really great at explaining all this stuff. You can see that we've got a few lectures on this, and I made one kind of note on every lecture that we did, really putting stuff in my own words as much as possible, trying not to copy from the lecture slides where possible as well, and it was quite nice. Alright, so the next topic was cardiovascular and breathing. Now really it's cardiovascular and respiratory medicine, which is done a lot more in depth in semester 2, but there is a kind of a base layer that we get in semester 1 as well. So I guess we get a little bit of quite basic stuff like on cardiovascular, looking at circulation and looking at kind of different blood pressures, comparing arteries and veins. That's something we do maybe even at National 5 level, at high school in the Scottish curriculum. So really stuff like that's still used in medical school, obviously building more upon it. Oops, and I'm now writing stuff on my notes accidentally. Fantastic. But yeah, we go over kind of different pressures, looking at arteries, veins, capillaries, all that kind of stuff, functions of blood. We also look at the heart itself, so actually looking at kind of labeling it up, different valves, trying to get all the anatomy kind of down and making sure that we understand that. And cardiac cycle, that's done a lot more in detail in semester 2, so I will talk more about that later. In terms of the respiratory side of things, there's not a lot actually in semester 1, but it does give you a bit of a basic idea of kind of, basic concepts that you do build upon in semester 2. So I guess better than nothing, but if you're a big fan of respiratory, unfortunately you don't do much of that in semester 1. And so the last physiology module from semester 1 is bioengineering. Now this is, it still counts as physiology, I would say, but it was quite interesting looking at kind of tissue engineering. Not a massive part of the course, to be honest, that's kind of tested on or anything, but I made some quite nice notes on this. I enjoyed listening to it, a little bit light-hearted, and kind of gives you this idea that medicine is always developing, and there's always going to be new technologies and new things happening. So it does give you that kind of perspective right from the beginning of your first year at medical school. We also did a little bit on medical implants, you can see, and I really like making these notes again. I think in my note-taking series I also actually made this note over there, so if you want to know how I made this kind of note, go check that out as well. But yeah, again, you're not really expected to know massive parts and kind of know everything in a lot of detail, but really it's to get the basic ideas down, that this is something that exists, this is kind of how it happens, and you'll probably be tested on it at some point in medical school. Okay, so now really, that was the main physiology part, really what's tested in your semester 1 test. Now the other part that is quite important is obviously anatomy, so I'll give you some examples of anatomy quickly. So we look at neurovasculature of the limbs, and I will just give you a very quick overview as to what that might look like. You get some lovely cadaveric images in there. We also look at joints of the upper limb, so yeah, basically it's in the name, joints of the upper limb. I quite enjoyed making the notes for these, it's quite fun. Also we do joints of the lower limb then, so it's quite self-explanatory stuff, but really you do need to know a lot of bones, a lot of muscles, a lot of tendons, etc. But really that's just stuff that even I'm not very confident on yet, so don't worry too much about learning it all, but yeah, try and understand the main concepts at least. We also do a bit of general joint stuff, so looking at the different types of joints, so like synovial joints, fibrous tissue, cartilage, these kind of different types of joints. Really, again, the basics. Also in anatomy, we do a bit on head and neck. Now, I actually got these images from the app that I use. It's called 3D Anatomy 21, Complete Anatomy 21. Gives you 3D anatomy model, and it's really nice to explore, and that's where I got these images from. A really good resource. I will link it down in the description as well, but that was good fun making those notes. So again, looking at kind of bones, muscles, innervation, etc. Then we also did a bit on the hand specifically, so look away if you don't like cadaveric images, but yeah, again, kind of labeling up from the lecture slides, looking at the different parts of the hand. Also in anatomy, we do a bit of general. What's in this folder? I've even forgotten. Yes, so this is actually one of the first things that you do in first year medicine, and you're looking at kind of imaging actually. So x-rays, what do you actually see? So what does the black parts in an x-ray actually tell you? You're not going to be asked to read and kind of diagnose things from x-rays just yet at all, but it is good to get an idea of what kind of things you could be looking at. So looking at MRIs, CT scans, etc. as well, and the differences between them. And yeah, so we also do a little bit on fascia and fascial planes. So yeah, there's quite a few cadaveric images in here actually, so yeah, I probably won't go through a lot of this, but yeah, really looking at the fascia of the human body. There's also quite a bit on cell organelles and cell tissues. Now, this is the sort of stuff that we do in high school that's really carried on into medical school. So really, if you're looking for examples of what kind of happens, you can see here that there's quite a bit of stuff, like for example, all the stuff about animal cells, that's really taken from National 5 and higher biology at school, so that kind of stuff is in medicine. Also looking at the different types of tissues as well, sort of fair bit on that actually, and yeah, I mean, you need to know quite a few different types of cells and tissues, and that is all translated later on in semester 2 topics as well. So it's just kind of getting used to that basic terminology. And the last bit of anatomy then was about the back, the vertebral column, and the spinal cord. So again, looking at bones, muscles, and innervation, that's the kind of structure that we get. So just kind of looking at the nerves and the innervation here, you can see really labeling up every part of the nerves, looking at the different types of nerves and really breaking it all down. And same here with the bones as well, you can kind of get an idea of what kind of terminology would be used in terms of diagnoses as well. And again, these images either taken from lecture slides or the Complete Anatomy 21 app, which is really useful for making your notes. Okay then, so that's the kind of main chunks of semester 1. I guess there's also clinical pharmacology, which I found actually quite confusing, but really you need to know kind of different types of receptors, the different classifications of drugs, so kind of looking at NSAIDs, inflammation drugs, and I think different types of receptors is really, I just went back by accident there, really the different types of receptors is quite important to know about in semester 1. Also looking at selectivity, desensitization, agonists, antagonists. You can see an example of a note here. This is stuff that I remember doing in high school. So again, there's a few new terms like partial agonists you wouldn't have heard of, and inverse agonists, but really like competitive antagonists and so on, that kind of stuff we have been over in high school. So you can see we're looking at different mechanisms of drugs as well. Really a very kind of base layer, but look, there's different types of receptors, different targets for drug action that we really do need to know about, and that is the stuff that you would be tested on in your exams. So really there's quite a lot of stuff in here. I'm not going to go through everything, but yeah, looking at sympathetic nervous system, linking that to the nervous system physiology module, parasympathetic nervous system, really what's happening here, what kind of drugs act where, and you need to know a few examples of drugs, but really not a lot of stuff. But that is some stuff that's taken from high school as well again. So also in semester 1 we did SEAM and REBM and KCP. So I'll just go through all of them briefly. So SEAM, then we did 2 units. So we did understanding illness. Now you have some essays that you need to write for the SEAM unit. I should probably explain what SEAM is. It's social and ethical aspects of medicine. And yeah, it's looking at kind of illness narratives, illness journeys, how people feel living with illness. You know, it can affect people in different ways, and we need to take into account these social factors when we look at a patient in the future. So yeah, you need to write a few essays on these, unfortunately, as well. But yeah, it's an interesting side to medicine, kind of away from all the science and the kind of in-your-face physiology and anatomy. And we do a little bit of medical ethics as well. It kind of continues actually to semester 2, but really looking at the main principles of medicine, looking at consent, capacity, the legal side of things, different morals. We also look at different theories, more in semester 2, but I'll go over that as well. And we also have knowledge to clinical practice, which is the new addition to this year 1 curriculum. So really, this is the more clinical side, putting everything into context of diseases and different conditions and illnesses that people could actually suffer with. So, when we were looking at all of the bones and locomotor stuff, we did osteoarthritis as our KCP module. So we actually put it into actual context, looking at, real patients who had joint pain and people who had, rheumatoid arthritis and osteoarthritis and so on. And then we kind of did a bit of history taken on that. We discussed it, had some in-person sessions on that, looking at the management and the treatment, risk factors, and so on, and kind of doing a bit of homework on that and then going in and discussing it with the lecturers as well. And again, we did that for trauma as well. So we went through different trauma systems, looking at how timing is really important when it comes to trauma cases, and so on. So you can see that with every topic that we did in the physiology module, we kind of had a KCP to match that as well, to put it into some sort of context. Alright then, so let's move into semester 2 then. So semester 2, building upon the stuff that we did in semester 1, some new stuff as well. So the new physiology module was called Sustaining Life, Not Body in Motion. So Sustaining Life, we did about 6 kind of main modules, some of them kind of repeating over from semester 1. So the first one we did was embryology, and that's really about all about the embryos in the womb and how they kind of develop, and conditions that can come with that as well. Some stuff from high school in there as well. So you can see kind of with going from blastocyst to the epiblast, quite a lot of kind of flow charts in there, different types of twins that can occur, that kind of stuff. And you need to know that in quite a fair bit of detail actually. How does the embryo form, different axes, different layers, how does it become a three-dimensional kind of organism really, and its growth with that, different hormones involved and so on. So really from the beginnings of life all the way up to how did they develop, and really after that what deformities can actually occur if things go wrong as well. So I won't show you too many nasty pictures, but yeah, looking at things going wrong as well. So yeah, that was embryology. Okay, so next looking at the GI tract. So I think there's one thing that you guys will notice in semester 2. I did a lot less handwritten notes, and that was mainly because there was a lot of stuff to get through and a lot of stuff quite in depth. So I didn't really think it was very efficient for me to keep taking handwritten notes, even though that's my most ideal way of learning. But that's medical school for you. So we looked at kind of anatomy of the upper and lower GI tract. You can see kind of just looking at the basic organs, their functions, and just getting familiar with some terms. We also looked at quite a bit of the liver, so looking at the microanatomy of the liver, the different parts of liver cells, what different types of cells there are, what it looks like in histology terms as well, and the pathology of different cells in the liver. We also did a bit of digestion and metabolism, so looking at how specifically kind of what organs play a role in digestion, but also looking at kind of the digestion of proteins, fats and carbohydrates as the main three, also looking at iron, B12, folate and so on, and how that is digested. There's also a bit of metabolism stuff here. It looks very complicated. I still don't think we need to know it in this much detail at first year anyway, but really to give you an idea of the complexity of metabolism in the body, and it gives you some lovely simple flow charts that everyone can definitely follow, but that's you'll have many times where you'll feel like that in first year. There's an awful lot to sort of absorb and just kind of learn, but it will make sense eventually, I'm hoping. So yeah. Okay, so now swiftly moving on to respiratory and cardiology. So really quite large chunks of the semester 2 course. So respiratory, we look quite a bit at gas exchange. So looking at the different types of respiratory failure. Just giving an example of, we were looking at type 1 respiratory failure, type 2 respiratory failure. Hopefully that gives you a bit of an idea. I'm not going to go into a lot of detail at all because really this is quite a complicated topic. We also did a bit on respiratory diseases, looking at obstructive diseases, restrictive diseases, interstitial lung disease as well. Looking at main symptoms, how you can kind of get an idea of what a disease could be when it comes to the lungs. Looking at different lung tests as well, and so also we looked at arterial blood gases and the acid-base kind of stuff as well. So really clinical blood gases, you can see here that we're looking at the kind of hydrogen ion concentrations in arterial blood, how we can measure that, looking at the partial pressure of oxygen, partial pressure of carbon dioxide, bicarbonate, and how we can tell if someone is in respiratory failure, and which type as well. So it's a bit confusing, but once you get the hang of it, it's actually quite satisfying. Okay, and cardiology as well, really quite a big block of the course. So starting up with cardiac cycle, we had a few lectures on that, looking at how the heart actually pumps blood. So you need to know it in a lot more depth, believe it or not, than at what you knew at high school level. The idea of preload and afterload, stroke volume and heart rate, and what all of these terms actually mean. And actually along with that, how do kind of action potentials and different ions in the heart cells make the heart contract. So looking at sodium in the heart, potassium, calcium, etc., and kind of comparing that to skeletal muscle as well. So yeah, again, quite complex ideas to get your head around at first, but when you get the hang of it, it's quite interesting. And yeah, we did quite a bit on ECG as well. So ECG, we looked at tachycardias, we looked at bradycardias, heart block, what the different parts of the ECG are, kind of just normal conduction in the heart as well. ECG leads, not that we would be expected to put ECG leads on at the moment, but getting an idea of kind of how the ECG is interpreted and put on as well. Looking at the different types of heart rates, irregular heart rates. So we looked at atrial fibrillation, we looked at bradycardias, and so on. So you can get a bit of an idea. And we also looked quite a bit at some of the drugs that we can use for different heart conditions. So looking at lipid lowering, so, looking at the mechanisms of statins, for example, and other drugs to use for lowering lipids as well. Looking at drugs for angina as well, and their mechanisms. We also looked at antiplatelet drugs. So there's a lot of significance actually in a different topic as well about antiplatelet and anticoagulant, but I'll go into that after. Anticoagulant comes up there, and also drugs for heart failure as well. There's a few drugs that we can use, and we need to kind of know their mechanisms, where they act, and so on. Then that's the pharmacology side of things. We also have a bit of cardiovascular disease. So really looking at the differences between, an embolism, an infarction, a thrombosis, and so on, and kind of how can you distinguish between all of these. I'm sorry for the squeamish images, by the way. Also looking at hypertension, that was quite a big part as well. So the other part was about exercise. So looking at how we can do exercise tests. So there's a test you can do, make someone run on a treadmill with an ECG put on, and you can kind of track how does their body adapt to the different oxygen level and breathing rate, and how that affects your heart, and so on. So kind of exercise's role in medicine testing, but also just generally for people's lifestyle as well. And cardiac biomarkers, which is actually really important. So looking at how can we diagnose a stroke, or how can we diagnose a heart attack or heart failure, for example. So looking at the different risks for that, looking at the different markers that we should be looking out for when we test to see if someone has had a heart attack or not. Okay, so the next part then is the integrity module. So this is really the immune system, so immunology, as well as kind of cancer, infections, looking at the microbiome and all that. So if we start with them maintaining the cells, body structures even, so you can see here that this is really to do with the replication of DNA, all of that cell biology, really from National 5 and higher biology at school. So DNA repair, we're looking at mutations, DNA transcription, formation of proteins, amino acids, etc. All that stuff in a bit more detail in first year medicine. So we also look at the microbiome, so microbiome in health and in diseases, and how that can have an effect on us as we grow up, and if we don't have a good microbiome, a healthy microbiome, how that can lead to cancers, for example. Also looking at the different types of infection, infectious diseases, and the transmission of infection, contamination, how infections kind of get passed on. This is a good summary actually. Of really how you can get in contact with different infections, their spread, and so on. And that's quite important, because if someone is infectious in a hospital, we need to obviously contain that and make sure that they don't spread it to other people in the hospital. So hopefully that gives you a good idea. Now, immunology, this is one of the most difficult parts of the first year course, I found anyway, but really it's about the innate immune system, but also the adaptive immune system as well. So like, for example, in the adaptive immune system, we're looking at different types of B cells, really looking at their roles. We're looking at clonal selection. It's quite a lot of new terminology for me, at least. I found it quite hard, still find it quite hard. But yeah, different receptors, how do the T cells and B cells work together, recognition of antigens, antibodies, etc. And there's a lot of complex stuff in here, so let's just get out now. We also look at apoptosis, so I know that cell injury and stuff you kind of look a little bit at in high school, but necrosis, so uncontrolled cell death and controlled cell death, we look at all that. Actually, this is a good summary to show you kind of what we do with the immune system module. look at autoimmunity and hypersensitivity, like allergies, near the end as well, but also looking at cell injury and death and adaptive immunity and so on. So yeah, that's the immune system part. After that, we also do the cancer part of the course, which again I found quite interesting but also quite difficult. So if we look at kind of how cancers form, the different types of cancers, really what kind of things to look out for, kind of red flags, so you can see different types of cancer cells forming, and there's a lot of information on here about how all this happens and how you can get cancer forming. We also get a bit of specific stuff on lung cancer, which was quite interesting as well, and how cancer specifically occurs in the lung. We also get a bit on skin cancer as well, which was a really nice summary and a really nice sort of overview of skin cancer, and we got some questions and things to do on that as well. And you can see that looking at different layers of skin tissue, and yeah, like as you can see, it's pretty self-explanatory stuff, but still quite interesting, and putting that into the context of skin cancer. Okay, and the last little bit in the physiology of semester 2 was about hematology, so really all about the blood. So looking at how we can read the full blood count investigation, so specifically looking at anemia, hemoglobin, lymphocytes, neutrophils, etc. And this is quite a nice summary sheet as well to show you the kind of things to look out for and what it means if something's high and what it means if something is low. We also look at kind of how blood cells are formed, and how we get platelet aggravation. So if we get a cut, how does the body deal with that? Looking at what happens to vessels and what can happen if there's something going wrong. So for example, like hemophilia, looking at this pathway, it looks very complicated, but really how do we get a clot forming, or how do we get a kind of plastering of a cut or a wound after injury? So yeah, that's that. We also do a little bit on venous thromboembolism and how to sort of control that, and you can see I've got a little summary here as well, but really looking at clinical features, treatment, formations, and etc., all that kind of stuff. And yeah, like different medications as well, actually looking at anticoagulants versus anti-platelet drugs as well. So looking at like warfarin, aspirin, etc., drugs like that, and their mechanisms and how they can help or not help with venous thromboembolism. So that was the main physiology in semester 2. Now the anatomy side of things for semester 2, there was not a lot, but we did have a bit on cardiology. So really looking at the anatomy of the heart, looking at all the vessels, all the muscles, lovely cadaveric images there as well for you. We also looked at kind of the general plumbing of the body, so looking at veins and arteries, and where they are, and their functions and features, and what can happen if they go wrong, and so on. A lot of stuff on there. Now we also did a bit of respiratory anatomy, so really looking at the lungs and ribs and that pleural cavity to see exactly what parts of the lung are where, labeling that up, looking at different muscles and vessels that are connected in there as well. Now we also did a bit on like kind of respiratory tract as well, so coming down, down from the trachea, and what happens after that, looking at all the nasopharynx and the sinuses, and then coming down. So yeah, quite interesting stuff there as well. And the last bit of anatomy we did was about the pelvis, so really looking at bones, joints, muscles, innervation, histology, all that stuff. And we kind of did that for the male body and the female body because there's slight differences, but really looking at different joints there in the pelvic cavity and so on. And I really like these notes, actually. Nice colour code in there. Highly recommend you do that if you're taking handwritten notes. And yeah. Alright, so that was a quick overview of anatomy, then going into the social and ethical aspects of medicine part. So we did quite a bit. Again, we had a few essays to write. So this was really looking at things in the community. So the social influences in the community and how kind of inequalities such as, life expectancy and, your financial situations, etc., how that can really affect your health and the access to health that you have, or good health even. So we're looking at different interventions for that, you know, how social isolation, for example, can really affect people's health, that impact, risk factors, all that stuff. We had a few case studies, so you know, looking at what's been happening to ethnic minorities during COVID. Yeah, so really, you know, quite a lot of stuff there to get through, really. We did a bit of health economics, if anyone's interested in that side of things as well. Not a lot, but just kind of understanding how cost works in medicine as well. Now, the other thing that we did is a bit of REBM stuff, so the research part of medicine. So you can see that we had different types of studies looking at, so diagnostic studies, prognostic studies, you know, looking at different reference ranges, also more about health economics. Clinical trials was quite a big part as well, you know, having these definitions noted down about what is efficacy, what is effectiveness, what does that actually mean, how do drugs get from, you know, a very developing stage all the way into hospitals and being used for different diseases. And KCP was also returning, and this time we did some more interesting disease, again linking to the physiology unit. So when we were doing the embryology unit, we had a whole KCP on pregnancy and kind of what drugs you would be advised to use and what drugs you probably shouldn't use, and that kind of effect on the embryos for that. We also did kind of diabetes when we were looking at the GI tract and all of the stuff on digestion and metabolism and all of that, so that was quite a nice link. Now when we were doing the respiratory stuff, we looked at breathlessness. Cardiology, we looked at chest pain and palpitations and hypertension. You can see that we had a few kind of analogies here as well from Grey's Anatomy, so you know, medicine can be fun as well, and kind of looking at different analogies to see how does hypertension work. Now we also did a bit of rheumatoid arthritis as well, looking at that again, so that was quite nice with the immunology side of the course, looking at why does this inflammation and this why do we lose this integrity, and why we get autoimmunity as well. We also looked at breast cancer and cancer in general as well, and that was again when we were doing the cancer unit. This was really kind of looking at some cases actually and identifying you know, what are the red flags in this case and why would we suspect or why would we try and test to see if this was a cancer or to rule out if this is a cancer or not. Alright, so that was really a big kind of summary of all of MBChB Year 1 at Edinburgh University. Now, I do want to show you just on the side, this is not related to the course directly, but the study group. Now, we made a little study group. I think it's about 6 of us who made the study group, and really we went over topics and we thought that teaching was a really good way to consolidate knowledge for ourselves, but also to obviously help everyone in the group. So then we kind of split up the topics. So one week, you know, I was doing something on heart failure, you can see here. So this was really fun to really put things into poster, really also look at the potential with Samsung Notes here. I really love to make all of these posters. This is one of my favourite parts of Year 1, and I made loads of posters on many different topics, actually saved pictures of them, put them into PDFs, shared them around, and there was quite a few that I made and a few that I was really proud of actually. So you can see, really nice way to summarise things, consolidate knowledge, teach things, and it was a good way to revise when it came to revision time as well. Alright everyone, so I hope that was kind of useful, a bit enjoyable as well. If you have any video suggestions for me, leave them down in the comments, and hopefully I will see you with another video on Sunday. Please do go and follow the HSTV Instagram at HSTV Official. I always post behind the scenes and extras and little updates here and there, so I hope that you guys can get involved with that as well. Other than that, yeah, I will see you all very soon with another video. Goodbye.